According to a new key coronavirus model, Ontario could see thousands of new COVID-19 deaths by January 1st.
I'm concerned about fall and winter.
A concerning forecast for the colder months ahead when it comes to coronavirus deaths, says Dr. Ali Mokdad with the University of Washington's Institute for Health Metrics and Evaluation, or IHME. It's projecting more than 7,300 COVID-19 deaths in Ontario by the first day of 2021, just over 3 months from now. A stunning surge from the current number of fatalities in the province of more than 2,800. These numbers are shocking.
These numbers are shocking, but the key issue here is we can change them by our behavior.
Behavior like physical distancing, frequent hand washing, and widespread mask wearing that could potentially save lives between now and the end of the year, says Dr. Mokdad. The IHME's projected increase in people dying from COVID-19 is driven in part by seasonality, explaining that to date, COVID-19 has followed seasonal patterns similar to pneumonia. If that correlation continues to hold, northern countries like Canada can anticipate more cases in the late fall and winter months.
Is plausible.
Infectious disease epidemiologist Dr. Ashley Tude with the University of Toronto reacting to the IHME's numbers, saying the challenge with the projection is factoring in the unknowns, like policy changes and just how everyone will behave.
I think for Ontario, we should use this as a bit of a wake-up call in terms of what the worst case scenario looks like, in terms of, this is where things could go. And hopefully those projections are too high. And the reason that they would be too high is because we've responded, because we recognize that if the virus is allowed to circulate uncontrolled, this is the sort of future that we could see.
Over the weekend, the Ford government expanding new measures province-wide aimed at stemming the spread of the virus by limiting private social gatherings to 10 people indoors and 25 outdoors, with stiff fines for rule breakers. What do those new restrictions mean for your numbers?
That's very important. So in our models, we take into account such mandates. So one of the mandates is gathering restriction. And the fact that Canada is doing it at this time is very good and encouraging, because you want to be at a lower number when you start this peak going up in fall and winter. And doing this at this time is very smart and a sound decision.
We reached out to Ontario's Ministry of Health to see if the IHME's projection lines up with the government's modeling. They referred us back to a report released on April 3rd that projected a maximum of 15,000 COVID-19 deaths in Ontario. That's the smaller bar, with public health measures in place over the course of the pandemic. No firm timeline, though. The taller bar represents a possible outcome with no restrictions. As for the recent rise in cases, on Saturday, Ontario's Associate Chief Medical Officer of Health said,
"At this point in Ontario, our numbers are rapidly going up. It is a wave. Are we seeing the big second wave? Or are we seeing a smaller wave? Really, it's hard to say.